Hello everyone, I'm Yusuf Miguel Tan and we're going to talk about diseases. There are so many diseases found in the world. Some of them can be cured and some don't. But we're specifically talking about cancer. Cancer is a very scary word. Almost everyone knows someone who got very sick or died from cancer. Most of the time, cancer affects older people. Not many kids get cancer, but when they do, very often it can be treated and cured. What is cancer? Cancer is actually a group of many related diseases that all have to do with cells. Cells are the very small units that make up all living things, including the human body. There are billions of cells in each person's body. Cancer happens when cells that are not normal grow and spread very fast. Normal body cells grow and divide and know how to stop growing. Over time, they also die. Unlike these normal cells, cancer cells just continue to grow and divide out of control and don't die when they're supposed to. Cancer cells usually group or clump together to form new tumors. A growing tumor becomes a lump of cancer cells that can destroy the normal cells around the tumor and damage the body's healthy tissues. This can make someone very sick. Sometimes cancer cells break away from the original tumor and travel to other areas of the body, where they keep growing and can go on to form new tumors. This is how cancer spreads. The spread of a tumor to a new place is called metastasis. Causes of cancer. Doctors are unsure why some people get cancer and others don't. They do know that cancer is not contagious. You can't catch it from someone else who has it. Cancer isn't caused by germs like colds or flus. So don't be afraid of other kids or anyone else with cancer. You can talk to them, play with them, and hug someone with cancer. Kids can't get cancer from anything they do either. Some kids think that a bump on the head causes brain cancer or that bad people get cancer. This isn't true. Kids don't do anything wrong to get cancer. But some unhealthy habits, especially cigarette smoking or drinking too much alcohol every day, can make you a lot more likely to get cancer when you become an adult. Finding about cancer. It can take a while for a doctor to figure out if someone has cancer. That's because the symptoms cancer can cause, like weight loss, fevers, swollen glands, are not caused by cancer. When someone has this problem, it is often caused by less serious, like an infection. But with medical testing, the doctor can figure out what's causing the trouble. If the doctor suspects cancer, he or she can do tests to figure out if that's the problem. A doctor might order x-rays and blood tests and recommend to the person go to see an oncologist. An oncologist is a doctor who takes care of and treats cancer patients. The oncologist will likely run other tests to find out if someone really has cancer. If so, tests can determine what kind of cancer it is and if it has spread to other parts of the body. Based on the result, the doctor will decide the best way to treat it. One test that an oncologist or a surgeon may perform is a biopsy. During a biopsy, a piece of tissue is removed from a tumor or a place in the body where cancer is suspected. Like the bone marrow, don't worry, someone getting this test will get special medicines to keep him or her comfortable during the biopsy. The sample that's collected will be examined under a microscope for cancer cells. The sooner cancer is found and treatment begins, the better someone's chances are for full recovery and cure. Treating cancer carefully. Cancer is treated with surgery, chemotherapy, radiation, or sometimes a combination of these treatments. The choice of treatment depends on the type of cancer someone has, or B, the stage of the tumor. Surgery is the old form of treatment for cancer. 3 out of 5 people with cancer will have an operation to remove it. During surgery, the doctor tries to take out as many cancer cells as possible. Some healthy cells or tissues may also be removed to make sure that all the cancer is gone. Chemotherapy is the use of anti-cancer medicines to treat cancer. These medicines are sometimes taken as a pill, but usually are given through a special intravenous line, also called an IV. An IV is a tiny plastic catheter, straw-like tube, that is put into the vein through someone's skin, usually on the arm. The catheter is attached to a bag that holds to the medicine. The medicine flows from the bag into the vein, which puts the medicine into the blood, where it can travel throughout the body and attack cancer cells. Radiation therapy uses high energy waves, such as X-rays, and visible waves that can pass through most parts of the body to damage and destroy cancer cells. It can cause tumors to shrink and even go away completely. Radiation therapy is one of the most common treatments for cancer. Many people with cancer find it goes away after receiving radiation treatments. With both chemotherapy and radiation, kids may experience side effects. A side effect is an extra problem that's caused by the treatment. Radiation and anti-cancer drugs are very good at destroying cancer cells, but unfortunately, they also destroy healthy cells. This can cause problems such as loss of appetite, tiredness, vomiting, or hair loss. With the radiation, a person might have red or irritated skin in the area that's being treated. But all these problems go away and hair grows back after the treatment is over. During the treatment, certain medicine can help a kid feel better. While treatment is still ongoing, a kid might not be able to attend school or be around crowds. The kid needs to rest and avoid getting infections, such as the flu. When he or she already isn't feeling well, the body may have more trouble fighting off infections because of the cancer or side effects of the treatment. Getting better. Remission is a great word for anyone who has cancer. It means all signs of cancer are gone from the body. After surgery or treatment with radiation or chemotherapy, a doctor will then do tests to see if the cancer is still there. If there are no signs of cancer, then the kid is in remission. Remission is the goal when any kid with cancer goes to the hospital for treatment. Sometimes this means additional chemotherapy or radiation might be needed for a while to keep cancer cells from coming back. And that's it, guys, for today's lesson. Hope you learn and understand something about cancer. Thank you.